the direct link between a vitamin deficiency and heart disease. Our heart is a precious organ, tirelessly working to keep us alive. Heart disease doesn't always come knocking with obvious symptoms. Instead, high blood pressure and plaque buildup in arteries are silent predators, waiting for the right moment to strike. You might not even know there's a problem until it's too late. Crazy, right? The truth is, there were subtle hints leading up to a heart attack. What if I told you there is a direct link between a common vitamin deficiency and heart disease? Something seemingly innocuous, such as a vitamin deficiency, could set the stage for a cardiovascular catastrophe. Symptoms of this vitamin deficiency include extreme fatigue, mouth ulcers, red and swollen tongue, nerve problems, muscle pain, depression, and memory issues. But how does this vitamin deficiency specifically contribute to heart disease? It messes with the lipid profile and throws off how the heart pumps blood and circulates it through the body. Well, it boils down to one thing: its job in breaking down an amino acid known as homocysteine. Let's break it down. Homocysteine is not a fun guest to have in our bodies. It's like that annoying friend who messes things up when they hang around too long. This troublemaker can damage our blood vessels and even create blood clots. Not cool, right? And if that's not bad enough, it can lead to plaque buildup, clogs up our arteries, and makes it challenging for blood to flow freely. Say hello to heart attacks, kidney issues, and a bunch of other heart-related woes. Crazy how one little amino acid can cause so much chaos. Let me drop a little truth bomb on you. B vitamins are the secret sauce for a healthy heart. We are talking about folic acid, vitamin B6, and B12 here. These guys are crucial to maintain adequate levels of B vitamins to support the proper metabolism of homocysteine and reduce the associated heart risks. We often don't give them the credit they deserve. But why are they frequently neglected? Well, their deficiency can be sneaky. It doesn't always show up with flashing lights saying, "Hey, I'm causing heart issues." Instead, it is more like feeling tired or weak or having weird neurological stuff going on. It's like trying to solve a mystery without all the clues, making it challenging to pinpoint without proper investigation. Tricky, right? B vitamin deficiencies can significantly increase the risk of heart attack. Our heart is a muscle that constantly works, beating around 100,000 times daily to keep us alive and well. To function correctly, it needs various nutrients essential for heart health. By incorporating vitamin B-rich foods into our diet, we can give our hearts the love and support they deserve. But here's the deal. When stress comes knocking at our door, it's not just our mental health that takes a hit. Our B vitamin levels also take a nosedive, hanging our heart health by a thread. And here's where it gets interesting. When those B vitamins bail on us, our homocysteine levels shoot through the roof. Think of it like adding fuel to the fire of heart disease. Those high homocysteine levels wreak havoc on our blood vessels, making heart attacks and other heart-related issues more likely to crash the party. Wild, right? Our genes can also mess up our folate and B12 levels. A sneaky gene mutation called MTHFR loves to stir the pot. And let me tell you, it can cause all sorts of chaos, from wonky blood clots to health problems, eye issues, pregnancy loss, some forms of cancer, hearing loss, and even messing with our minds. This gene mutation is more common than you think and often remains undiagnosed. Sometimes our bodies don't absorb folate and B12 like they should. It's like they're being picky eaters, turning their noses at these essential nutrients. And let's not forget about our diets. Sometimes our diets don't give us the goods we need. It's like trying to fuel up on junk food before a big race. Not going to get you very far, huh? There is another hidden reason your B12 levels might take a nosedive. Well, blame it on those pesky medications. Meds for stomach ulcers and heartburn are the usual suspects. Even antibiotics, corticosteroids, and a bit too much alcohol intake can mess with our B12 levels. Deficiency of B vitamins is 4 times more dangerous for heart health than high cholesterol alone. But here's the twist. While munching on greens, beans, grains, and top-notch beef helps, sometimes it's not enough to fill our B vitamin tank. That's where daily B complex supplements step in to reap the full benefits for heart health. But watch out for those synthetic forms of B complex and multivitamins that contain B6 as pyridoxine hydrochloride, B9 as folic acid, and B12 as cyanocobalamin. Stick to the good stuff, and your heart will thank you. Let's keep it simple. Folate is the natural form of vitamin B9 found in yummy foods like leafy greens and beans. On the flip side, folic acid is its synthetic cousin, often found in supplements and added to fortify everyday items like flour and cereal. But here's the kicker. Not all folic acid gets turned into the active and usable form of vitamin B9 in the body. Now, if you've got the MTHFR gene mutation, listen up. Stay away from supplements with synthetic B9, folic acid, B12, cyanocobalamin, and B6, pyridoxine hydrochloride. On the flip side, we've got the natural MVPs, pyridoxal 5-phosphate, methylcobalamin, and methyl tetrahydrofolate. These are the real deal when it comes to B6, B9, and B12. And guess what? Even if you have that MTHFR gene mutation, your body's cool with these chaps. And I'll drop some good ones in the description box for you. Easy peasy. For those following a vegan diet, obtaining adequate B12 poses a challenge. While the road to B12 sufficiency may have a few twists and turns for vegans, with a bit of knowledge and mindful planning, you can navigate it with ease. You'll mostly find vitamin B12 in animal products like meat, fish, eggs, and dairy. While some plant-based foods may contain B12, they often lack adequate amounts. Factors like soil quality and food processing can further diminish the B12 content of plant-based foods, making it even trickier for vegans to meet their daily requirements. For starters, incorporating fortified foods into your daily meals is a common practice to help bridge the B12 gap. People on a vegan diet often look for fortified whole grain cereal, plant-based milk, and nutritional yeast enriched with B12 to ensure adequate intake of this crucial vitamin. But most of these fortified foods contain synthetic forms of B vitamins that cannot always convert into a usable form in the body. Adding an active, methylated B12 supplement to the daily routine is the solution. Active B12 supplements offer a convenient and reliable way to meet your nutritional needs. Be mindful of your dietary choices and opt for naturally found B12-rich plant-based foods whenever possible. Incorporating fermented foods like tempeh and seaweed into your diet can also help boost your B12 intake. Let's talk about B-complex supplements and their sidekicks, medications. Sometimes they can get into a tangle. Take vitamin B5, for instance. It might mess with how well tetracycline antibiotics work. And then there's the multivitamins and B-complex crew, which sometimes comes with iron. Pair that with a medication like dimercaprol, which loves to buddy up with iron, and you've got a recipe for kidney trouble. But wait, there's more. Some medications can increase the odds of a B vitamin deficiency. In contrast, others can lower specific B vitamin levels in our bodies. It's a minefield. That's why chatting with a healthcare provider about potential tag team battles between your B vitamin supplements and the meds you're popping is super important. Safety first, folks. In the comment section, share your questions and concerns about any health issues you're dealing with. Stay healthy and take care of your heart.